Hey there. So you're gearing up for your OB and maternity exam. And if you're feeling a little overwhelmed by just how much material there is to cover, well, you're not alone. The goal of this explainer is to cut right through all that noise. We're going to zero in on the most important, the highest yield concepts that you're most likely to see on your test. This is the core knowledge that won't just help you ace the exam, but will truly be the foundation for your entire career as a safe practicing nurse.
All right, so here's our game plan. We've broken this review down into 6 key sections. We'll start with the foundations of modern care because understanding your patients is always step 1. Then we'll dive into the amazing changes of pregnancy in the body's blueprint. Section 3 is all about reproductive red flags, those common disorders you have to know. Then in Section 4, we'll trace fetal development from genes to gestation. Section 5 will cover reproductive choices, and we'll wrap it all up in Section 6 by connecting everything back to your path to safe practice. Let's get started.
Okay, let's dive right into Section 1, Foundations of Modern Maternity Care. Before we can even begin to talk about conditions or treatments, we have to start with the most important piece of the puzzle, our patients. Truly safe and effective nursing care is built on understanding and respecting the incredibly diverse people you'll be caring for every single day.
I want you to take a good look at this number on the screen, 2045. Just let it sit there for a second. Why this year? Why is this specific date so unbelievably important for the future of nursing right here in the United States? What could this possibly mean for your practice? Because by the year 2045, the U.S. Census Bureau projects that the country will become minority white. And this isn't some far-off abstract idea. This is the fundamental reality of the patient population you will be serving throughout your career. This demographic truth makes cultural competence. Well, it makes it a non-negotiable, absolutely mission-critical skill for every single nurse. So this brings us to 2 opposing mindsets, and you have to know the difference. On one side, you have ethnocentrism. That's the default belief that your way of doing things, your culture's way, is the best or only way. To be a safe practicing nurse, you have to actively fight against that. Instead, you have to practice cultural relativism. This means you make the effort to learn about your patient's culture and apply their standards to their care. It might be as simple as understanding who they want in the delivery room or respecting specific dietary practices. It's all about building trust, and that's where good outcomes begin. Okay, now that we've set that crucial foundation of patient-centered care, let's move into Section 2, the body's blueprint. We're going to explore the absolutely profound physiological changes the body goes through during pregnancy. These adaptations are a huge focus on exams, so let's really break them down. Take a look at this number. We're talking about a 40 to 45% increase. What is that? That's the massive expansion of total blood volume during pregnancy. Think about that. The body is creating almost 1.5 times its normal amount of blood. It has to do this to supply the growing uterus and placenta and, of course, to nourish the fetus. And as you can imagine, this has a huge direct impact on the heart. And to handle all that extra blood, what do you think has to happen? Well, the cardiac output. That's the amount of blood the heart pumps out every minute. It also has to increase dramatically by 30 to 50%. The heart is just working that much harder to keep up with the new demands of the pregnancy.
So, these huge cardiovascular changes lead us right to a classic exam gotcha: supine hypotensive syndrome. Here's what happens. When a pregnant patient in her 2nd or 3rd trimester lies flat on her back, the weight of that heavy uterus presses down on the inferior vena cava. This squishes the vein and drastically cuts down blood return to the heart. The result? A sudden drop in cardiac output, which makes the patient feel dizzy, look pale, and maybe even pass out. So what's your number 1 nursing intervention? Positioning. You need to tell the patient to lie on her side, and the left side is best, to get that uterus off the vena cava.
Of course, the changes go way beyond the cardiovascular system. Let's run through these other high-yield points. First up, respiratory. Progesterone makes the body more sensitive to CO2, so the patient starts to breathe a little faster and deeper. This state of mild hyperventilation blows off more CO2, creating something called respiratory alkalosis, which actually helps the baby get rid of its own CO2. Next, the GI system. Progesterone relaxes smooth muscle, which slows everything down. That's why constipation and heartburn are so common. And finally, the urinary system.
That same muscle relaxation causes the ureters to get wider, leading to urinary stasis, which means urine just sits there longer, making it a perfect breeding ground for bacteria and raising the risk for UTIs.
All right, let's shift gears to Section 3, Reproductive Red Flags. In this section, we're going to focus on some common disorders that love to show up on exams, because being able to tell them apart is absolutely critical for patient safety.
Okay, here is a classic point of confusion. The difference between primary and secondary dysmenorrhea, which is just the medical term for painful periods. Primary dysmenorrhea is caused by chemicals, specifically an excess of prostaglandins that make the uterus contract painfully. That's why the management is NSAIDs and heat, because NSAIDs block those prostaglandins. Secondary dysmenorrhea, on the other hand, usually shows up later in life, and it's caused by an actual pelvic problem, like endometriosis or PID. Your job as a nurse is to recognize that if a patient's pain suddenly changes or starts years later, it's a red flag that needs more investigation to find the real cause.
And speaking of pelvic inflammatory disease, or PID, you need to remember this. It's a major red flag. PID is an infection that travels up from the cervix, often from an untreated STI, and it can cause terrible scarring in the fallopian tubes. This scarring leads to two devastating outcomes: ectopic pregnancies and permanent infertility. This is why patient education about preventing and treating STIs is a primary nursing role. This is what being a safe practicing nurse is all about: preventing these life-altering problems before they even start.
All right, time for a practice question. Just like you might see on the NCLEX, a patient comes to you for advice on managing her PMS. As her nurse, what is the best initial action you can take? Is it A, recommend a diet high in red meat and sugar? B, suggest herbal therapies, yoga, and massage? C, tell her to push for medications right away? Or D, discourage the use of diuretics? Take a second and think it through. The correct answer is B, and here's the rationale. The nursing process always prioritizes the least invasive interventions first. Patient education about things you can do without medication, like diet changes, exercise, and stress reduction, that's the cornerstone of initial PMS care. Answer A is wrong because that diet can actually make symptoms worse. C is wrong because you're skipping straight to meds. And D is incorrect because a provider might actually prescribe a diuretic for bloating. So B is the best starting point.
Okay, for Section 4, we're going to shift our focus from mom to the developing baby. We're going to cover the absolute must-know milestones and support structures that chart the incredible journey from genes to gestation.
This timeline highlights 4 incredible milestones. At just 4 weeks gestation, the tiny heart begins to beat. By 8 to 12 weeks, you can actually hear that heartbeat with a Doppler. Now, this next point is absolutely crucial for viability. At 24 weeks, the lungs start making surfactant. Surfactant is the soapy substance that coats the inside of the tiny air sacs, the alveoli, and keeps them from collapsing when the baby exhales. By 32 weeks, there's usually enough surfactant for the baby to have a really good chance of survival outside the womb. This is why surfactant is so critical when we're managing preterm labor. Now let's talk about the placenta. It's basically the baby's all-in-one life support system. And while it's super complex, you can break its role down into 3 main jobs. First, it's an endocrine gland, pumping out hormones like HCG, that's what a pregnancy test detects, and progesterone to maintain the pregnancy. Second, it has a metabolic function. It acts as the baby's lungs, kidneys, and digestive system. And third, it's a transport system, moving all the good stuff like oxygen and nutrients to the fetus and carrying all the waste back to mom to get rid of.
Now, in Section 5, we're going to talk about navigating reproductive choices. This is all about the super important role nurses play in counseling patients about contraception and infertility, an area where clear, correct education is directly tied to patient safety.
When you're talking with a patient about contraception, it's really helpful to organize the options into these 5 big categories in your mind. You've got fertility awareness methods, barrier methods like condoms, hormonal methods like the pill, long-acting reversible options or LARCs like IUDs, and finally, permanent methods like sterilization. Your job isn't to pick for them, but to explain the pros and cons of each so they can make a truly informed choice for themselves.
Okay, listen up, because this is a huge safety issue and another classic exam gotcha. When it comes to combined hormonal contraceptives, things like the standard birth control pill, you must know this absolute contraindication. You cannot give them to women who are over 35 and smoke more than 15 cigarettes a day. The combination of age, smoking, and estrogen puts them at a dangerously high risk for blood clots. Asking about this is a critical safety check that every safe practicing nurse must perform.
And that brings us to our final section, Section 6. Let's pull all of these ideas together and connect them back to the ultimate goal. Remember, this isn't just about passing a test. It's about preparing you to be a safe, competent, and caring nurse.
I really want you to let this quote sink in. Every single fact you're memorizing, every pathway you're learning, it all connects back to your future professional responsibility. The hard work you're putting in today is literally the foundation for the safe, excellent care you're going to provide to your patients. You are building your professional identity right now.
So, as you finish up your studying, really focus on these high-yield concepts. Try to go beyond just memorizing and really understand the why behind all these changes. Make sure you can tell the difference between those red flag conditions. And please, commit those critical safety contraindications to memory. Mastering these core ideas is your most direct path to acing this exam, and more importantly, to stepping confidently into your role as a safe practicing nurse. You've got this.